In this video, I'll talk about the differences between relines, rebases, and repairs of dentures. And needless to say, there's lots of different kinds of all three of those, so I'll only touch on a couple. For a reline is a typical thing that needs to be done to a denture because of the natural resorption that occurs over time in the palate, not the palate, in the alveolar process and ridges of both the maxillary and mandibular. So a common way for this to be done, it can be done chair side or it can be sent to the lab. If you're doing it chair side, then you have the patient remove their denture, of course, and then you essentially you're like pouring in more putty, I guess you can say, into the palate area and over the entire denture, and then it will harden over time like the rest of the denture will. And you place it back in the palate, and then bam, now it fits appropriately, if that makes sense. And then another kind, I think that the way, if you send it to the lab, is the same thing as what's called the hard reline, where you take the denture. This is going to be done over 2 appointments. You have the patient remove the denture, then sometimes you kind of take away some of the base, like on the palatal area, to make more room, I guess. And then you can put some kind of like a alginate type material, maybe a PVS, back on it over the entire thing. Place it back into the patient's mouth to get a new impression, essentially. Remove it once it's hardened, of course, and then since that part is removable that you just added to the denture for the reline, you send that to the lab. The lab removes it and then replaces it, and it will look better. So the benefit of the chairside reline is that it's done in one appointment and it's cheaper, but it might look homemade and kind of cheaply done. And then on the flip side of that, the rebase, the pro is that it will look nicer, but it will take longer. And a lot of patients don't want to be without their dentures for a couple of days. A third option is you can kind of do it yourself. They sell kits for like a soft reline at like Walmart or Walgreens, and you mix the stuff together, pour it in, and you fix it yourself. Probably the worst looking option, but probably the cheapest and the fastest if you don't have the time or money to visit an actual dentist or prosthodontist. A rebase is what it sounds like in the fact that you're replacing your entire base of your denture, maxillary, or mandibular. This one might be challenging for me to describe, but I will try. So you have your denture. Oh, and this is done for patients. It should be done every couple of years because your the bone resorption is just going to happen, and you should just take care of that. Make sure it fits properly. So you remove the denture. You take a master impression of the whole thing. So of all the sides, you are encapsulating it into an impression type material, probably more like a stone cast or something in between that. I'm not entirely sure. Anyhow, so you take that, and then it's in two parts, like a top half and a bottom half, and then you remove it. You take away or okay, so once you've done that, now you have the impression of the teeth, but then you also have the impression of the existing palate. And then with the existing denture, you remove that palate entirely. So all you have are the original teeth. And with that, you can put just the little teeth back into the impression so you know exactly where they go. And then with the help of the lab, they'll have all of that, and um, they'll have like the palate impression too, so they can make it brand new and your teeth just how they were, so you don't have to like redo measurements or anything like that. Just bam, they'll make a new base, put exactly how it was, except now it fits. That's my understanding. And then as for repairs can just be done like a zillion different ways because there's a million different things that can go wrong with a denture. For example, if you snap a tooth, like a chipped tooth like anybody would get, you can fix it sometimes with something as simple as super glue, or they have special glues especially for um, denture teeth. But can anybody really tell the difference? Maybe, maybe not. Do at your own risk. But yeah, so that's probably like the cheapest possibility. Another repair that has to take place sometimes is that the denture base and the whole thing will just split right in half. And again, maybe you can do like some kind of super glue type thing. Wouldn't recommend it. Your dentist can take an impression of your palate again as it is or as it was if they have the previous one. And they can use some kind of epoxy to stick it back together just how it was, and then bam, fixed. Other times they might have to reinforce it with kind of like a rebar type thing to keep it stable and strong. But yeah, that should cover relines, rebases, and repairs.